My name is Murky Sloan and I'll be your pharmacist today. LB is a 47-year-old female that presents to the emergency department after persistent diarrhea that started yesterday. She stated that she has had 4 to 5 stool movements yesterday and 2 today. She assumed it was something she ate but denied ever having diarrhea that's lasted more than a day and none recently. When we asked her about her antibiotic exposure, she admits of just recently completing a 3-week course of clindamycin for her foot infection. Her past medical history indicates hypertension, diabetes, and a diabetic foot ulcer relating to it. She has no pertinent family history, but her social history indicates that she has no health insurance. Her medications include Lantus prefilled syringe, where she injects 20 units sub-Q daily, and she missed her dose last night. Humalog, where she injects 8 units sub-Q with meals, and her last dose was before dinner. Januvia 100 mg tablets by mouth daily, and she missed yesterday's and today's dose. A women's multivitamin, 1 tablet by mouth daily, and she's not sure when her last dose was. Atorvastatin 40 mg by mouth daily, and her last dose was taken yesterday. A lisinopril 20 mg tablet by mouth daily, and her last dose was taken yesterday. She also takes Tylenol 325 mg tablet by mouth as needed for headaches, and she's not sure when her last dose was. As for allergies, she has anaphylaxis to penicillin. Her immunizations are also up to date. Overall, the patient complains of stomach cramping and persistent diarrhea. Her physical exams show a positive for bowel sounds in her abdomen, and it's also soft and tender. She also complains of cramping. Her vital signs show a blood pressure of 140/77, a heart rate of 73, a temperature of 99.5 degrees Fahrenheit, a pulse of 14, a height of 64 inches, a weight of 177 pounds, and a BMI of 30.1 kilograms per meter square. Her lab results show a glucose level of 146 milligrams per deciliter, a white blood cell count of 13,400 cells per milliliter, and a creatinine clearance of 71. Her diagnostic tests show positive for both toxins and antigens in her C. diff toxin antigen stool sample test. Overall, the patient has an initial episode of mild C. diff. Based on the IDSA C. diff guidelines, the patient has several clinical indications for C. diff. She has recently finished a course of clindamycin, has more than 3 unformed bowel movements per day, and has a white blood cell count of less than 15,000. Her white blood cell count indicates that it's not a severe infection, and her toxin and antigen diagnostic tests both came in positive. There is a high recommendation of vancomycin due to evidence and advocacy. However, due to the patient not having health insurance, we would recommend a reconstituted vancomycin that will decrease the overall cost for the patient. Overall, our goal for this treatment is to eradicate the C. diff toxins, relieve her symptoms, and keep from reoccurrence. For the treatment, we recommend vancomycin 125 milligrams by mouth 4 times a day for 10 days. Overall, this treatment is well tolerated, and for improvement, she should see a relief in symptoms, her fever to become normal, and solid bowel movements. What questions do you have?